And just following up on Monday's post, just a little bit more of an explanation of what should be done during a hearing test. It is so much more than just beeps. Beeps give us the bare minimum of what your hearing system looks like. Yes, we need that to set a hearing aid appropriately if that's the avenue that you move towards or move down. But we also need to know how your system performs in quiet and in noise. That really gives us that full picture of everything. So, in addition to the beeps, you should be repeating words at a loud level, single words in each ear by itself. And what I would advise you is when you get your hearing test done, ask if this is being done with recorded materials versus someone saying them to you. Why is that important? Well, it completely changes the validity of the test. My voice is different from someone from the Northeast, from the South, from the Midwest, and so those changes in our voice can change how you perform. So when it's recorded, it's standardized. Doesn't matter where in the world you go to get that test done. It's going to be more consistent and the same every time. So ask for that test to be recorded. And again, that gives us an idea of how well your ears can tell differences between similar words. So for example, the difference between hat versus cat. The other test that should be done, and a common concern that patients will report to me, is I struggle in background noise. There's a test for that, and that's something that we routinely do here at National Hearing and Communication Center. So it's a test where you're listening to a sentence, repeating a sentence, and there's varying levels of background noise. That tells us how well your system can perform and how well it can handle speech in noise. And so, why is that important? Well, it helps us determine which level of technology is best for you if we need more support, more processing from the device versus less. And then it also helps us set those expectations. We talked about this a few weeks ago in one of our posts that the hearing aids or any device can only do as well as the system can do. So if your system struggles in background noise, then again, we just want to make sure we're setting up those expectations appropriately. So again, recap, you should always have beep testing done. You should always have single words done with recorded materials at a nice loud level to try to give you the best audibility during that test, and then as well as speech and noise testing to see how your system handles communication or speech in noisy, challenging places, which is likely a common concern for you. If you have any questions, leave them in the comments and we'll be happy to answer them. Have a great day.